Hello, everyone, and welcome to a very special bonus episode of Public Health Lens. Today, we are talking about something at the heart of all good public health work: collaboration. And not just in theory, but in practice. Because let's be honest, none of us does this work alone. To explore this, I'm joined by someone I deeply admire, Dr. Rizwana Biviji. She is an assistant teaching professor at Arizona State University, a co founder of the Arizona Maternal Health Policy Coalition, and a brilliant thinker when it comes to turning policy into action. Rizwana, welcome to Public Health Lens. I have been so looking forward to this.
Thank you so much, Nitika. I'm genuinely excited to be here. I have been following your podcast and just love how you're creating space for these conversations.
Thank you. Let's dive in. I've seen you do such powerful work with the Arizona Maternal Health Policy Coalition. Can you share what inspired you to start it?
Absolutely. It really started with this frustration that academic research and community voices weren't always in the same room. I kept thinking, why are we doing all this research if it's not reaching to the people it's meant to help? So, through my collaboration with the 4th Trimester Arizona and the Arizona Birth Workers of Color, we brought together researchers, clinicians, non for profits, all committed to improving maternal health in Arizona. It became clear really quickly that the power is in co leading this work and not just advising from the sidelines.
Yes, I love that. Co leading, not just consulting from afar. And you all are tackling some big issues. I remember you mentioning a project about Medicaid and lactation services. Can you tell us more about it?
Yes, that one's close to my heart. So, our community partners told us again and again that postpartum moms on Medicaid want lactation support, but they can't afford it. So, our team developed a policy brief showing how Medicaid reimbursement for outpatient lactation care could make a difference. Now, that brief is being used to have conversations with Arizona's Medicaid agency, Access, for expanding outpatient lactation support in the state. It's still unfolding, but that's what collaborations can do. It moves ideas into actions.
Well, that's incredible. And such a great example of research, policy, and lived experience coming together. What do you think makes collaboration work? Because it's a buzzword now, but it's not always easy.
Right? It's one thing to put collaborative on a slide, and it's a totally different thing to build real relationships. For us, it's been about trust and clarity, knowing your lane, but also being open to learning. Academics bring one kind of expertise, but community organizations bring deep, often underappreciated knowledge. We've grown to listen better, to slow down, and that's made all the difference.
That resonates so much. As a consultant, I've seen how collaboration only works when there's shared ownership and mutual respect. So, for those listening, whether they are consultants, students, or health professionals, what's your advice for building stronger, more authentic collaborations?
I would say start with people, not problems. Spend time building the relationship before you jump into planning. Ask more than you tell. And be okay with not always leading. Sometimes support is the most powerful role that you can play.
I love that. Start with people, not problems. That's going on sticky note on my desk. Last question before we wrap. What keeps you inspired to do this work?
That's a big one. Honestly, the people. The students who ask big, bold questions. The moms who keep showing up despite every barrier. And the partners who believe that change is possible, even when it's slow. So every project reminds me that we are not alone in this work, and that gives me hope.
That's such a powerful note to end on. Rizwana, thank you for your time, your honesty, and for the work you do. And to all of you listening, this officially wraps up season 1 of Public Health Lens. It's been an amazing journey sharing these 11 episodes with you. But don't worry, this isn't a goodbye. Season 2 is already in the works, and we will dive deeper into topics like mental health, community health assessments, substance use, and more. Until then, stay collaborative, stay hopeful, and stay curious. Thank you for being here. We are just getting started.